Yeah, go ahead.
Okay, hi, I'm Darryl Wayne Peterson, hand orthopedic surgeon, presently located in College Station, Texas.
All right. Hand and orthopedic surgeon. So, what is that?
So it basically means that I take care of illnesses, injuries, and conditions involving from the fingertip to the shoulder.
Okay.
I was initially trained primarily as orthopedics, finished a residency in the military in 1992. Finished my military time, and then I did a hand fellowship at Louisville Kleiner Institute, where I then spent the rest of my career primarily taking care of problems in that area of the body.
Okay. One thing that we commonly hear questions about is just about soreness in people's joints,
Sure.
Fingers, all of that. Is soreness at a younger age, is that a sign of either one, is it arthritis, or is it something more serious?
Well, so you bring up a good point. So generally, soreness and stiffness, especially in a younger person, can be some type of arthritis, such as inflammatory, a variant of, say, rheumatoid arthritis, or do they have a variant of lupus, or it could just be from what is commonly called overuse,
Okay.
which is inflammation without joint change. It could be in the tendon, the joint, the bone, and it's our job to try to figure out just what is that pain generating.
Okay. Now, I'm from the old school, so thing about cracking knuckles.
Sure.
Is that good for you? Is that bad for you? Is that going to cause arthritis at an old age? What's the truth?
So the truth is, as it stands in the literature, and it's never been proven to cause arthritis.
Okay.
So we find that people who can do that, they may have a little more laxity. They've developed that skill over time, but just the act of popping your knuckles itself hasn't been shown to cause arthritis.
You said it hasn't been.
Has not been proven
Okay.
to cause it. Yes.
Okay.
Yes.
So all those knuckle crackers out there, they're smiling right now.
They have a skill that a lot of us is causing. Now, first off, you have deformity. If you can look at your hands and it's deformed, you want to seek our help.
Okay.
So that's the first thing. But if it's inflammation and it happened acutely that day or the day before, we typically use rest and ice and elevation.
Okay.
If it's been going on for a longer time and it's at the end of the workday or the next morning, you can use moist heat. Moisture with heat, a little water on a towel or maybe on a small warming pad, and that to help loosen up joints and tendons. So acutely inflamed, rest and ice, chronically or at the end of a day, heat.
Okay. So moving up the body a little bit to the shoulder, you know, people have always seem to have some sort of shoulder problems.
Sure.
Shoulder soreness.
Sure.
Is stretching good for that? What can happen?
So again, if it's an acute injury, obviously seek medical help. But generally, almost the same thing. If it's a acute problem at the end of activity, you want to use ice. But you also want to make sure you do keep the shoulder is all about motion and strength. So we got to keep the motion. You want to make sure that we do something that strengthens, maybe isometrics. Which means keeping the muscle at the same length, its normal length, and taking care of the pain.
Okay.
Now, if the pain persists, it may be something as subtle as a rotator cuff problem. So what is the rotator cuff? These are the four muscles, CUFF, that come together to allow you to take your arm away from the body and to rotate it away from the body, or to rotate it in. So those are involved in diseases and problems, like people can say soreness or stiffness. You can with time get it just with age, or you can get it from activity, either acutely, throwing a ball, falling, or slowly from accumulated activity with time. So you want to make sure that if you don't respond to things you can do at home, rest, ice, stretching on your own, then you seek medical help, because that could be a major cause.
Okay. So what's the fine line between activity and overuse?
Very, very good. So basically, if you do something repetitively and you stay within the parameters where you don't have pain, that's activity-related pain or no pain. If you get to the point where you do it enough, or you go outside the regular activity, you start to hurt or ache, that's the body's inflammation system, and pain cascade telling you something's wrong. So that's probably a good example would be, our parents will all tell you we used to walk both ways going to school uphill.
Yep.
So, but that was their regular activity. Now, if you add to that harvest time and that same walk, they might be sore. So that's overuse. So that's a good example to help you. My wife's from Detroit. Many people she grew up worked in factories. They do a certain amount of activity. There's a certain amount of tolerance they made for that. But you could do that so much, maybe in a wrong manner, regular activity becomes overuse.
Okay. Now you spoke also about inflammation. So how important is food when it comes to inflammation of maybe the joints in your hand?
Correct.
Yeah.
So we know we have several areas to talk about in terms of food inflammation. First, you could just have a food allergy. So it's very important to know if you eat a certain food causes you a problem. Nuts are very common. I grew up on a strawberry farm. There are people who are allergic to strawberries. So that's one thing. Then you have foods that are natural anti-inflammatories, such as berries, blueberries. So do you have a food allergy? And can you use natural fruits and vegetables to help lower your inflammation potential? So there are natural extracts for anti-inflammatory you can take. So food is very important. So obviously you want to have a healthy diet, rich in what the FDA says you should have fruits and vegetables, good protein, but you can increase your inflammation level by some people have gluten problems. So you want to kind of know your own self.
Okay. What are some of the common ailments that you see coming through your door and everything?
Right, so the most common ailments that we treat fall into two categories. There are injuries. So from a hand orthopedic standpoint, the most common injuries are fractures of the metacarpals, which are the bones that go from the wrist to towards your fingers. And from a non-injury time, there's an entity called carpal tunnel. So what that means is the nerves that help you feel your thumb, index, long finger, and part of your ring finger, that nerve is under irritation. And so the word carpal comes from the Latin word for wrist. And the tunnel means that nerve lives in a certain area, bounded by bone at its base and a little soft layer, and it becomes irritated. And so you get excessive hypersensitivity, commonly known as numbness.
Okay. Now, my mom had carpal tunnel. I had my mother-in-law who had carpal tunnel.
Correct.
What are some things, I know you may wear that wrist, the band sort of thing, but what are some of the things to sort of reverse carpal tunnel?
So it's interesting you brought that up because it's seen almost twice to 3 times as much in women.
Okay.
And so the first line of treatment for it is a simple immobilization with a wrist brace early, because the longer you let it persist, then the harder it is to cure it, even if you have to have surgery. So I always tell people the most important thing is to come early when those non-operative treatment works. What are those options? A brace, as you mentioned, anti-inflammatory medicines. If it's related to certain activity, stop it. Sometimes it's as simple as using a Bluetooth instead of holding the phone against your head all the time and putting your wrist in abnormal positions, which push pressure on that nerve.
Okay.
Sometimes it's cured by Bluetooth. The company's like that, but it could be that simple.
Okay.
If you let it persist for 6 months to a year, then simple measures don't work, and you have to talk about doing other things that we do when you come to see me.
Okay. Do you have any questions? In the meantime.
There are some questions. I'm not sure if this is, but I feel a cold sensation under my skin and at different parts at different times. Is that something you can address with just a couple?
Sure. Okay, so you're talking about sometimes people complain of either cold sensation, hypersensitivity, different temperature changes. So correct. So we worry about that being is basically 2 types of problems. Can it be a nerve generation problem or nerve problem in the hand itself or upper extremity, or is it part of a systemic disease that's circulating your bloodstream? So 2 good examples are nerve compression, which can cause that sensitivity, i.e. like we talked about carpal tunnel, or is your nerve compressed in your neck, which is cervical spine. So we look into that. Or very common in our African American population are inflammatory problems such as systemic lupus. So that can be diagnosed with a blood test, along with me listening to you to see if you have it elsewhere, do you have other problems. So, but we diagnose that with a blood test. And the earlier you find those, there are great medicines for them now that didn't exist, say, when you and I were born.
Okay.
So it's important to get that looked into.
So we have like similar but opposite questions. So someone's saying that they have pain that feels like fire.
Right. So again, so abnormal, when people say they have abnormal sensation of temperature, that's regulated by the nervous system in conjunction with, the nervous system and the vascular system. So we start looking primarily at those two causes. It could be something as simple as you have something that you wear that causes allergic phenomena irritating the nerve. It could be you're putting your hand in some type of chemical or a new job where you're exposed to a different environment. Or it could be that you have an inflammatory disease like systemic lupus that circulates, or it could be nerve compression. Or it could be a thing that's very common from just called reflex sympathetic dystrophy, where your small nerves to your blood vessels send out abnormal input to the blood vessels. They either dilate, you feel too hot, or they constrict, you feel too cold.
Okay.
So we look into all that. But generally, if you can't solve it in a reasonable amount of time, a week to a month on your own, then seek medical attention, because we do have cures for these things that don't require surgery.
Okay. That brings up a good question where I was going to ask. So when does a person come to see you? Because most of the time we may say, oh, it's just a little soreness. It'll pass.
Right. So a reasonable amount of time where it doesn't pass is about a month.
Okay.
Or if it becomes to a point where it changes your life. When it interferes with your life, then the disease is winning. It's out of balance. You can say, well, okay, it doesn't bother me too much. I can live with it. But if that goes on for a month, or if it changes your life in a week, that's when you should seek our attention. That's pretty much the general guidelines.
Okay. A couple more questions. Is there anything that, besides just the regular dumbbells and things like that, that we can do to strengthen our muscles and joints within our shoulders and hands? Right.
So the first thing, of course, is to try to be flexible.
Okay.
So flexibility is an important component of the muscles moving the joints in space. Then, of course, the first thing you want to be able to do is you also want to be able to try to handle your own body weight. So can you handle your own body weight in lifting, bring yourself up out of a chair? Very important as we age to keep that ability to control our body weight. So any exercise that does that, but flexibility and strength training go hand in hand.
Okay. Age brings up a good point. Sometimes people say, oh, that's just my old age. Are there certain things in your 50s, 60s, or 70s that you should still be able to do?
So we say that you should be able to walk, sit, and enjoy the regular activities of daily living that you did in your 50s, in your 70s. You should be able to exercise. And if you can, if that exercise profile changes, or your work profile, or your ability to sit in a chair, can you sit through a 2-hour movie without pain? Can you drive half a tank of gas in your car without pain? All those things you should be able to do even at 70. Okay, especially now because people are living longer. So we want to get you, in our field, we try to get you back to what you like to do.
Okay. So how can people find you online?
Correct. So you can obviously you can always find me at I have my email presence, and I can be found at the bonetofix@AOL.com.
You said bone?
Bone, B-O-N-E, 2, the number 2, fix, F-I-X@AOL.com.
Okay.
It's probably the best way to reach me.
Okay.
And I thank you all for your time.
Thank you so much. Thank you. We're sending that out to all of our viewers right now to make sure that they can also get in contact with you. And we're here right at the National Medical Association 2018 conference. Thank you, Doctor.
Thank you very much.